That newly authorized pill is called Paxlovid. Data from clinical trials shows that it can reduce hospitalizations and death by 89% for high-risk unvaccinated patients if taken within 3 days from when the symptoms begin. CBS News chief medical correspondent Dr. Jon LaPook joins us to sort it all out for us. Dr. LaPook, it's good to see you. Let's talk about that pill right away.
Morning.
It says 3 days within symptoms. Do you have to officially be diagnosed, or do you just have to think, well, I'm feeling something? Because I know a lot of us think we're feeling something these days.
Yeah, I think it's, a combination of the two. And it's actually within eventually 5 days, because even when you take it within 5 days of symptoms, you decreased the risk of hospitalization and death by 88%. This is a protease inhibitor, and it works differently than the vaccines. It's working on the virus's ability to replicate, and it shouldn't really, theoretically at least, be affected by all these mutations that are going on, at least not dramatically. So it's a very exciting development, very promising.
How soon do you think it'll be available?
Well, there was an announcement by the government yesterday that said that the first 65,000 courses for 65,000 people would be available about the beginning of January. So that's not very many. And then hopefully as the year goes by, it's going to be rolled out in the tens of millions. It does take a long time, many months, to make a pill. And they started this many months ago with the idea, well, if it is successful, let's make sure that we have some in the pipeline.
Should vaccinated people take it too?
Well, remember, it's only if you have COVID. So people shouldn't think, okay, I've got Paxlovid coming down the pipeline, and so I don't have to worry about getting vaccinated. If there's one message that we know for sure, that you should get vaccinated, and if you're vaccinated, you should get boosted when you're eligible, because that dramatically decreases the risk of hospitalization and death. In fact, the CDC just announced that people who are unvaccinated have 20 times the risk of dying as people who have, the full vaccination.
Yeah, I'll never understand why people would want to wait for a pill when there's something that can help you right now. I don't understand what's going on in people's minds, but I've heard people say, well, I'm just going to wait for the pill. I'm glad you said, please don't do that. Any idea how much it will cost?
Yeah. Well, I think it's a little bit more than $500, but that's going to be paid by the government. The government has said this is going to be free or covered by insurance, I guess, for people. So it's not an outlay. That's not the problem right now. The problem is ramping up enough supply. I mean, imagine 65,000 is not nearly to drop in the bucket when you think about how many people, hundreds of thousands a day now, are being infected. So it's super important right now with the holidays coming that people are very careful, especially in the week before they get together with loved ones, because that's the time when you think about it, if there's a 1 to 3 or 2 to 4 day incubation period for Omicron, that week before people get together is really crucial. Of course, if they can get rapid testing right before, like the moment before they're about to take off their masks, that's even better. It's not perfect, but these are layers of protection. And the better the mask, the better the protection. So I'm thinking these days of really the highest quality N95 or KF94 or N95, KN95, whatever. I think the loosely fitted cloth masks or surgical masks, loosely fitted, aren't as protective. Yeah, the better the fit. The fit is really important.
Yeah. Another point that we need to keep making over and over and over again. We heard what appeared to be good news yesterday, John, where they said that the Omicron variant is not as severe as Delta and others. Do you think that that's true? What did you make of that? Because it sounded very encouraging to hear.
Yeah, there is some evidence, some suggestions from South Africa and Scotland now most recently that it could be less severe. But be very, very careful, because remember in South Africa, for example, this was in a place that had a lot of underlying immunity because it had Delta had swept through or some other variants had swept through the country. So it's not clear why there was an uncoupling of the big spike in cases, and you didn't see as big a spike, the same curve in hospitalizations and even in intensive care unit stays. So that was very encouraging, and we saw something similar in Scotland. But I wouldn't say to people, again, if you're unvaccinated and boosted, if you're unvaccinated, don't think that it's going to be a milder version of this virus. You shouldn't assume that at all. It could be really dangerous to do that.
Now, let me tell you something, John. You don't want to get a mild version of this virus either. You really don't.
No, you could have a long haul. You could have long haul syndrome.
Right.
And, we don't know what the percentage of long haul is with people with Omicron or even with people who are vaccinated and boosted. So don't have one of these parties where you say, OK, I don't care. I'm giving up. I'm just going to go ahead and get infected because eventually I'm going to get infected. Don't think that way. Try to do everything you can to stay protected. And get vaccinated and boosted. We can't say that enough.
Nobody in this room is thinking that way. We're all vaccinated and boosted up. Thank you, Jon LaPook. Good to see you.